If you're over 65 and you've been living with joint pain, this might be the most important thing you watch today. Because what I'm about to share isn't from a supplement company, it's from rheumatologists. And the research behind it is changing how doctors think about joint pain. For decades, the answer to joint pain was simple. Take ibuprofen, use a heating pad, and just manage. But here's what most people don't realize. Long-term use of painkillers like NSAIDs in seniors over 65 comes with serious risks: kidney damage, stomach bleeding, increased cardiovascular risk. These aren't rare side effects. These are documented, consistent risks. A friend of mine, 68 years old, retired teacher, she was taking ibuprofen almost every day for her knee pain. Her doctor eventually sat her down and said, "We need to find another way." That one conversation sent me down a rabbit hole of research, and what I found genuinely surprised me. I went through over a dozen peer-reviewed studies from PubMed, the Arthritis Foundation, and AARP. And I kept seeing the same 3 natural compounds come up over and over again, not as folk remedies, as clinically tested alternatives that rheumatologists are increasingly recommending to their patients over 65. Let me walk you through each one. The first one is turmeric, specifically, yes, its active compound, curcumin. Now, I know what you're thinking. Turmeric? That's just a kitchen spice. That's exactly what I thought too, but here's what the research actually shows. A 2024 expert panel published on PubMed are involving rheumatologists and pain specialists across multiple countries found that 91.7% of experts agreed on curcumin's potential for managing osteoarthritic joint pain. 91.7%. That's not a small number. More importantly, studies have shown that curcumin reduces joint pain and inflammation comparable to NSAIDs like ibuprofen, but with significantly fewer side effects. The mechanism: curcumin blocks inflammatory cytokines and enzymes, the same pathways that painkillers target, just through a different, safer route. Now, one important note. Plain turmeric powder from your kitchen won't be enough. The key is bioavailability. Look for a curcumin supplement with piperine, that's black pepper extract, which increases absorption by up to 2,000%. Okay, the recommended dose for arthritis relief is typically 1,000 to 1,500 milligrams per day. The second compound is one most people have never heard of, Boswellia serrata, also known as Indian frankincense. A 2023 randomized double-blind clinical trial published in the journal Nutrients, one of the most rigorous study designs in medicine, tested Boswellia serrata on adults over 40 with persistent knee pain. The results? Participants who took Boswellia showed significant improvement in pain scores and quality of life over 8 weeks. But here's where it gets even more interesting. The same study tested Boswellia, combined with omega-3, and the combination outperformed either supplement alone, improving both pain levels and muscle function. A 2024 systematic review and meta-analysis, the gold standard of medical evidence, found that a specific Boswellia extract called aflapin was the most effective supplement for reducing knee pain and stiffness in osteoarthritis patients. The Arthritis Foundation now recommends looking for 5-loxane or AKBA on the label. My friend I mentioned earlier, after her doctor suggested trying Boswellia alongside physical therapy, within 6 weeks, She told me her morning stiffness had noticeably improved. Not gone, but noticeably better. And for someone who woke up every morning barely able to walk to the kitchen, that was everything. The third compound, this one surprised me the most. Undenatured type 2 collagen. Now, most people think of collagen as a beauty supplement, something for skin, hair, nails. But type 2 collagen works completely differently. It targets joint cartilage directly. Here's the science. As we age past 60, our body produces significantly less collagen. The cartilage that cushions our joints, particularly in the knees and hips, starts to thin. This is one of the primary drivers of osteoarthritis pain. In 2025, a major analysis published in the Annals of Medicine reviewed 12 separate clinical studies on undenatured type 2 collagen. The finding, every single one, all 12 studies reported improvements in joint pain and function. That's not common in medical research. When 12 out of 12 studies point in the same direction, that's a signal worth paying attention to. The mechanism is unique. Unlike other supplements that fight inflammation after it starts, type 2 collagen works through something called oral tolerance, essentially training your immune system to stop attacking joint cartilage. Typical effective dose, just 40 milligrams per day, much lower than regular collagen powders because the mechanism is completely different. So to recap, the 3 natural compounds rheumatologists are increasingly recommending for seniors over 65 with joint pain. Number 1, curcumin from turmeric, 1,000 to 1,500 milligrams daily, with piperine for absorption. Number 2, Boswellia serrata, look for aflapin, 5-loxin, or AKBA on the label. Even better when combined with omega-3. Number 3, undenatured type 2 collagen, 40 milligrams daily. Works through a completely different mechanism than regular collagen. None of these are overnight fixes. The studies show meaningful results over 6 to 12 weeks of consistent use. And importantly, these aren't things I'm recommending instead of seeing your doctor. They're things worth bringing up with your doctor. Print this out, show them the studies, have that conversation. If this video helped you, consider subscribing. Next week, I'm covering the specific exercises that Johns Hopkins researchers say can reduce knee pain by up to 40% in seniors. That one's worth sticking around for. The information in this video is for educational purposes only and is not intended as medical advice. Always consult your healthcare provider before starting any new supplement, especially if you are taking medications or managing a chronic condition.